Hey everyone, this is Dr. Zimmerman. Today I want to talk about the not so mild concussion, right? Nothing drives me more nuts and crazy than someone saying it's just a concussion, right? It's mild, you'll get over it, right? Well, let me share with you some data and statistics that shows how not mild this mild concussion is, okay? Having one concussion doubles your risk of dementia. One concussion doubles your risk of suicide. Okay? One concussion causes 20% disability in the military population and would be no different in a civilian population. Okay? Over 50% of people do not recover from one concussion. If you had a concussion playing sports as a kid, right? So basketball, soccer, football, lacrosse, hockey, skateboarding, rollerblading, riding your bikes, wakeboarding, skiing, any of those things, your memory is typically going to be impaired 30 years down the road compared to someone else your age who has not had a concussion. Concussion increases your risk for dementia, as I previously stated, increases your risk for Parkinson's disease, increases your risk for multiple sclerosis. Okay? So that's some data points out there for you. Okay? There's nothing mild about a concussion. Concussions are very severe and are a major driver of the chronic neurological and degenerative diseases that we see today, and that is supposed to be part of our future. We know about people who've committed suicide as a result of their concussions. Specifically, these individuals have been diagnosed with chronic traumatic encephalopathy, CTE. Okay? Get your concussions taken care of. If you tore your ACL, broke a bone, or anything else like that, what would you do? You'd get surgery on the ACL. You'd make sure your bone gets put back in place. You wouldn't go to the doctor and say, hey, man, I tore my ACL. I've got some pain here. Can you just load me up on painkillers and ibuprofen and Tylenol and take care of the pain for me? No. Why? Because you would never regain function. Why do we do the same thing with concussions? Why do you go and they're like, oh, let's give you your antidepressant. Oh, you've got anxiety too. Oh, you can't sleep either. Here's your trazodone. And so forth and so forth and so forth. You've got depression. Let's help you there. Okay. Why do we do that? The reason why you have depression, the reason why you have anxiety, the reason why you can't sleep, your mind's racing, why you're tired, you can't focus and concentrate, why you're irritable, why you're moody, why you've got light and sound sensitivity, why you can't hold conversations, why your memory's going downhill, why you've got vivid dreams, why you have this constant headache, even if it's not constant, why you've got this neck pain that won't go away no matter what you do with it, is because you had a concussion that has never recovered. You have to treat the brain. You have to find the parts of the brain that aren't working well, and you have to strengthen them. In the same way that you would get surgery, and then you'd start appropriate rehab to get your knee better after blowing out your ACL, you need to do the same thing with your brain. You need to identify it and then strengthen it, right? I can't wave to you right here with my right arm without activating a part of my brain. So find the parts of the brain that aren't working well and get it taken care of. Now, obviously, you don't know how to do this on your own. Find a provider who understands functional neurology, someone who can map out the brain, which parts aren't doing their job appropriately, and can strengthen them. And the best thing about the brain is, unlike that ACL that's going to take you 6 to 9 months to get better, your concussion, when you treat it right, can be significantly better in as little as 10 days. Some people respond even quicker than that. Okay? So I hope you learned something. Don't be scared. Concussions, while they are major and they are a traumatic brain injury, concussions can be helped. The only fear we should have is when you don't get the help you need, because as we've talked about, the problems with memory, your dementia that may happen now because you're at increased risk, your ability to have the job promotion you want because you can't perform the task you need, your marriage, your family, and your whole social life, because a concussion changes who you are because it is a brain injury. So I beg you and I plead with you, get your concussion taken care of. If you have one, if you know someone who's had a concussion, tell them there's hope. There are answers out there. There are people who know how to treat them. Why? Because I see people get better on a daily basis, and I know providers across the entire United States who help people get their lives back. Feel free to leave comments below. Let me know if you like the video. If there's something else you'd like me to talk about, just let me know.